Welcome to an all-new episode of Hatching for Health, where our mission is to create a platform for individuals to tell their story, to educate the public, and to build a more compassionate community. And today, we are going to be joined by Dr. Franklin Rose, a local Houston board-certified plastic surgeon and philanthropist. You can find Dr. Rose at his practice, Utopia Plastic Surgery and Med Spa, located in Uptown Park. And Dr. Rose not only performs countless surgeries, but while at work, he also spends his time providing reconstructive surgeries through his foundation, the Holly Rose Ribbon Foundation. We're also going to be joined by his daughter, Erica Rose, who is the director of the organization.
Breast cancer is a malignant neoplasm of the mammary gland. It is one of the most common causes of cancer fatality in women. Early detection through regular breast examination and mammography is key. Through self-examination, irregularities, such as lumps or masses, can be detected before the disease has had a chance to spread. The danger associated with all cancer, but especially with breast cancer, is that the disease can travel quickly once it has invaded the lymphatic system. The lymphatic system provides the perfect harbor for cancers to travel throughout the body.
Thank you guys for joining us.
Thanks for having us, Jessica.
Yeah, it's such a pleasure. I've known you guys in the community over the years, and I've been a patient through your med spa and a colleague and friend of yours through the law firm.
Yes.
So many things. I want to start, Dr. Rose, since it is Breast Cancer Awareness Month here in October, just to kind of give us a brief overview of breast cancer.
Well, unfortunately, Jessica, breast cancer is on the rise. When I was in medical school, it may be counted 1 in 22 American women would get breast cancer. Now it's about 1 in 6, 1 in 7, 1 in 6. Wow. And so, I mean, there's many statistical queries in that regard, and nobody really knows why. I mean, you could say processed food, this, that, or the other, but it certainly is on the rise. So we've had this mission to perform charitable reconstructive surgery. My daughter, Erica Rose, is an attorney here in town, and she's helping on something called the Rose Petals, which is sort of a little subgroup of our foundation.
It's the Young Adults Division, which...
Okay.
No, I'm not quite so young. It's for millennials, Gen Zs, and Gen Xs.
Wow, that's fantastic.
I had to expand it to Gen X. I'm still a millennial, but some of my friends, they're Gen X, so they're invited.
Yeah. Okay, that's fantastic. So tell me about like the early detection importance.
Well, I mean, breast cancer is one of those things that early detection is just paramount. And, you know, we have such good mammograms now. Self-examination, I mean, Jessica, in the last several months, I've had multiple patients in their 40s come in with breast cancer. It's, you know, they've been implanted or unimplanted. And so those patients undergo mastectomy with sometimes reconstructive surgery.
There is a study that shows that people with breast implants have a lower rate of breast cancer.
Really?
And you might be wondering why. Well, it's because before any breast augmentation surgery, you have to get a mammogram. And so that often saves people's lives, and it helps them with early detection. And a lot of times we partner with the Rose, which is another foundation, and they provide free mammograms.
Well, this implant is called the Motiva implant.
Yeah, tell me about that.
It's a textured implant.
It's the best in the kind.
We can actually open up this other
It looks like an
They're
implant I've seen
wonderful
before.
implants.
The last
They're very
time,
new.
Okay.
Here, Jessica, you can open up this implant.
Yeah.
The reason that it is so helpful, breast implants, is that it pushes the tissue more forward to the skin, and it makes self-examination more easily performed.
It does.
Interesting.
And so the mammograms, of course, are very helpful, but there's many studies that show breast augmentation patients have a decreased incidence of breast cancer versus unimplanted patients.
And that's why we started the mission of the Charity Foundation, is to help people that can't afford breast augmentations, that might have the BRCA gene, or they might have a relative that had breast cancer, and even if they don't have it themselves, we would love to provide them with breast implants.
Absolutely. I think it's a beautiful thing you're doing.
Yeah.
Speaking of, when you say like, so genetics, I know that that comes into play, your family history, you know, how important is it, like if you have a history of breast cancer, that is that more of a reason to be checked out?
I'm not sure. What do you think?
Well, yes, there is a genetic predisposition known as BRCA1, BRCA2. That does genetically, unfortunately, predispose a certain subgroup of patients to breast cancer. And so if there is a family history of breast cancer, I have a patient right now whose mother she's being followed at MD Anderson because her mother had breast cancer and she had a whole genetic workup. So if you do have, unfortunately, those genes.
Yeah, but you still, so in your family, I know that's actually part of your foundation.
My Aunt Holly passed away from breast cancer.
Right,
but
isn't that how your name came about?
She didn't have the BRCA gene. Sometimes people can catch breast cancer if they went through infertility. There's other factors that caused it. So my cousin and I we got tested. And Dana and I, her daughter, are collaborating on the event that we're doing. Neither of us has the gene, but we wanted to have our precautions done. My mom doesn't have it.
So Holly was your aunt that passed
yes,
on.
my former sister-in-law, Erica's aunt.
We love her.
My wife's sister, Holly Harwood Skolkin.
We called it the Holly Rose Ribbon.
She passed with stage 4 breast cancer.
But we founded it while she was still alive, and she lived 7 more years because it brought so much joy to her life to do these events and to help other people with cancer. And that's why we love having Claudia now, another cancer survivor here, who really has the same spirit as Holly.
We'll meet her in just a moment.
Yeah, no, I know that she's actually going to be joining us today as well. So tell me, I mean, how do you collaborate with, oncologists in the industry to assist these patients?
My dad, he knows everyone.
Right, because there's the mastectomy that takes place first, and then is there a time to heal before going into?
Well, we work particularly closely with some colleagues at MD Anderson. I was trained at New York University, and I have a colleague who was also trained there. And so, I mean, this happened literally. I do a little bit of yoga, and a yoga teacher, a young girl in her 40s, came to me during a yoga class. I have biopsy proven needle biopsy breast cancer, so she's over there seeing Dr. Edelman because it's a 2-part thing. First treat the cancer, mastectomy, partial mastectomy. Claudia, whom you'll meet, had a quadrantectomy, meaning a partial mastectomy with radiation.
And she's inspired a lot of people through her journey.
So there's many ways to treat the cancer, and then of course comes the reconstruction either at that time or secondarily.
Okay. So there's multiple doctors then you're working with, like
all
oncologist
over the country,
wise.
not just in the Houston. He has colleagues at Cedar Sinai. Of course, my dad won't operate on me, so I have my surgeons up in LA that I work with. My dad's licensed. He trained in New York. We have people all over the country. And part of my mission at the Rose Petals is we don't just do the events. We're doing one in Houston and one in Los Angeles.
Okay, that's incredible.
So if anyone wants to know more about the foundation, they can follow it on Instagram at the handles at Holly Rose Ribbon. And we're very excited about our Hope and Homecoming Gala that we're planning.
Right, so
Claudia's planning it with.
This was founded all the way back in 2005, is that right?
Yes.
The foundation?
Right, when
Holly was still alive.
Yeah, exactly.
Okay, and so the event that's going to take place, is that this year or next year?
We're going to do the kickoff. It's going to be 2026, but kickoff is going to be right after Super Bowl, not before. So around the end of February. And then the Homecoming Gala is going to be in the fall.
Okay, beautiful. Have you guys done this every year?
No, I was inspired because my as a Spirit Squad girl myself in high school, and now my children, they do cheerleading.
Okay.
And so I just love the homecoming spirit, and I thought, what a beautiful thing to do. My friend Claudia also, she was on homecoming court, and
beautiful.
I just thought, let's have a Hope and Homecoming Gala, not only to raise money for this charity, but also to collaborate with another charity, because there's homeless people out there that are inside of a shelter getting help, and they need surgery too.
Right, no, there's...
But in answer to your question, we've done many fundraisers over the years.
We used to do Kentucky Derby, but we've switched on to a different theme.
Beautiful. I love that. So going back to, just the surgeries in general, advancements in technology, I feel like there has to be from, years back, like what is going on now different from a, perspective of having a mastectomy than going in and having implants? Is there, advanced technology?
Well, there is. I mean, there's newer techniques. There's various slings. The imaging.
This is very new.
This implant is called the Motiva implant.
Motiva implant.
It has little micro texture on it. So, but really, I think the imaging studies are so much more advanced.
So it's from that, like the detection of it.
The detection is so much better. And then there's newer techniques of reconstruction as well, implant-based and other types of reconstruction.
At what age do you recommend people to actually do their first like mammogram?
It's
I say
controversial.
35.
Is it?
It's
Okay.
controversial.
My cousin said, and I, well, 35 is a good age.
Okay, because I always heard 40, but why not,
35
why
if
not
you
35?
have a family history, or if
Yeah.
you're getting a breast
Okay.
reduction, they make you get it anyway, so I did mine at 35.
Okay.
But some people say 40. But
Okay.
once you have implants, you do have to be more careful during the mammogram process.
We're going to be bringing on Claudia, and then I believe also your assistant's here.
Marina, yes.
I want to talk to her a little
I'm
bit
gonna
as
get going
well.
back to my office.
But it was, yeah, I'm so glad that you joined us. Yeah, I know you're going to have to
Thank
cut
you.
out.
Yeah, I just wanted everyone to know about the Hope and Homecoming Gala. You can follow along with
Yeah,
my dad's page.
tell us again where they
and
can
the
find.
hollyroseribbon.org, but we
Okay.
also have an Instagram handle.
Which is the full name as well?
Yeah, at
Okay.
Holly Rose Ribbon.
Okay.
And I'm at Erica the Rose.
Okay. Okay, perfect.
So you can follow our
Yeah.
gala.
And is
We'll have
yours
updates.
Dr. Franklin Rose, or is it Utopia?
At Franklin Rose MD.
My social media
Perfect.
assistant can
So
give
we'll
you
get
all
more
the
info from her.
information.
Franklin Rose MD.
Okay. So good to have you guys. Dr. Franklin Rose, you're staying put, and I will see you soon, Erica.
soon, babe.
We are going to cut to a commercial break, but before you do, I just wanted to share with you the Hatching for Health Foundation is now doing wonderful things in the community. This past weekend, we were able to go out to Ainsley's Angels event. We had a booth set up and did a raffle and met so many wonderful children there. So if there's any events you would like for us to attend, please do let us know. You can go to our website, hatchingforhealth.org. So we'll take a quick commercial break and be right back here.
No one plans to be in an accident. Big truck wrecks, car wrecks, and drunk drivers can cause catastrophic injuries, brain damage, amputations, and death. These cases require aggressive, tough lawyers. With over 100 years of experience, Thomas N. Thurlow and Associates will fight to get you what you deserve. There's no upfront cost, no obligation unless we win, and you pay nothing out of pocket. Call today to get the justice that's owed to you.
In 2020, I was going to work and the stairs of my apartment broke, and I went 20 feet through, breaking my back in 2 places and 5 discs herniated. I was scared, alone. After meeting Dr. Remy Nader and his staff, it got me back to not only the dad I used to be, but the person I used to be too.
At the International Center for Neuroscience, we take pride in providing you second opinions for your brain or spine problems. I'm Dr. Remy Nader, board-certified neurosurgeon. Let me help you get your life back.
Your private practice deserves more than sticky notes and missed calls. Funnel Cake MD is the HIPAA-compliant growth platform built for doctors and dentists. Manage calls, texts, and emails in one secure inbox. Book more patients, cut the admin chaos, and keep your front desk sane. Try it free for 14 days with full white glove onboarding so you're running smooth from day one. Don't let outdated software hold you back. Sweeten your growth with Funnel Cake MD. Start your free trial now at funnelcakemd.ai.
Funnel Cake MD, all-in-one tool to grow your practice.
Welcome back from the break. If you have just joined us, we are accompanied by Dr. Franklin Rose and now one of his lovely patients, Miss Claudia, and we've got Marina, his office assistant, who handles all of their social media. So it's lovely to have all three of you here now.
Thank you.
Thank you.
Yes, and we were talking about so many wonderful things with your daughter, your practice, the foundation, breast cancer awareness, and I know it's really special to have Miss Claudia here because she happens to be a breast cancer survivor and someone that you operated on with her recent surgery, or not too recent. So Claudia, why don't you tell me a little bit about your story?
To me, the Dr. Rose's surgery, his staff, everything their foundation is about. Well, just a little bit of backstory. I did not know where to go as far as support. I was paralyzed in my bed. I was just so upset, so sad. And one day, I'm laying in my bed, I'm looking at social media, and I see these beautiful events that Dr. Rose's wife and him put on, and I just was looking with admiration, like, gosh, I want to live again. I want to do these things again.
Right.
And one, I wasn't in the financial place to go to a party like that. I had just had surgery, and I was flat-chested. I had
You had
nothing.
just had your mastectomy.
I had mastectomy, and I wanted to live like all these people so much. And just randomly, I sent his wife a message, and I just said, "Your parties look lovely, they're beautiful, I would love to attend one." And I'm not kidding you, at 3 o'clock in the morning, I received a message, and I see Cindy Rose, and it just popped up.
Goodness.
Y'all, when I tell you, my heart just like melted. Anyway, she goes, "You have to come to the next event."
Yes.
And I said, "I would love to." Now, going through all the pictures and the photographs, everybody's dressed over the top. They're beautiful,
yeah,
and all
to
the
the
gowns,
nines.
all the dress to the nines. And, voluptuous. I mean, like, there's just all beautiful. What I once kind of was. And then I said, "I would love to. I don't think I would fit in." And she goes, "You absolutely will fit in. What do you need? What's going on?" Well, I didn't want to tell her I didn't have a dress to wear to this amazing foundation. Remember when we all dressed up, it was like the Persian-inspired party.
Right.
It
One
was
of the many
wonderful,
that they
one of the
put on,
many
yeah.
events. And she goes, "Not a problem." I had a dress, I had makeup, everything. She had.
So this was your first encounter with
my
them.
first encounter.
And
She didn't
this is
know
her not
me
even knowing
from
that
anyone.
you just went through breast cancer.
I did.
Just
I
started
told
to
her a little bit of what was happening.
Okay.
She had me makeup, hair, and a dress. She's like, "You're coming to this event."
It's beautiful.
When I tell you, I was in a t-shirt, pajamas. I have, had my surgery. I'm a mother of 2 children. And I'm like, I can't be with all of these people. I don't fit in.
Well, Claudia's surgical history is that she had at Methodist a quadrantectomy, a partial mastectomy, radiation, and reconstruction. And of course, the radiation can damage tissue a little bit.
Okay.
So she needed some further reconstructive procedures, which we've done through the foundation. And she's now she's a well-known decorator here in town and doing well.
Just the things that you allowed her to get back to living her life and feeling like a woman.
But really, her story, we've done dozens and dozens of patients, hundreds, in that regard.
Well, Claudia, tell me, just for viewers and stuff to understand, like, when were you diagnosed and how did you, find out? Like, what was that situation like?
I was diagnosed 9 years ago. I wanted a mommy makeover, and so I went to a doctor and thought, well, maybe I could get an augmentation and get, fixed up. Well, let me tell you, these surgeons are very, very thorough and our medical attention. Yes, they're like
exactly what we were talking about earlier.
Right. So I will do this, but I want you to see this doctor first. And so I did, and then the results came back that I did have, cancer, and so they moved on me immediately. And what I want people to know is that I did not have insurance. I had to do the research, and there are plenty of resources out there that want to help us.
Okay.
And if you need any help finding them, please contact me.
Because a lot of times at this point, people don't have the relationship with like a Dr. Rose at Utopia and knowing that they even have a foundation of their own doing this.
Absolutely.
So it's something that I think it's so wonderful that I now know this too, and any of the viewers, because it's just such good information, and the fact that you, as a plastic surgeon that can do that reconstructive surgery after is like.
But Jessica, I think the overwhelming point is that breast cancer patients have to self-examine. They have to get mammograms.
You do.
Because breast cancer is on such an uptick.
Right.
I mean, you can look at graph after graph. Just Google it. And it's, as I say, 3-4-fold increase over the last 30, 40, 50 years.
Which is just
mind-boggling.
I know, because
there's
there's so many people being cured in addition, which is like, why are so many more people getting it? It's like you think maybe that would offset, but it's not doing anything different.
Is it environmental? Nobody really understands. But as I say, implants are sort of protective. It makes self-exam. The rate of breast cancer among implanted patients is less than the population at large, for various reasons. Self-examination is more easily performed. They're more breast aware. They're getting more mammograms. So, but I've spoken to oncologic colleagues of mine, cancer colleagues. Why is it on? probably more so than any other cancer, solid tumor cancers. And it's just, you know, it's sort of, to me, it's distressing to see, because I see so many younger patients. I see it in my office all the time, younger patients presenting with irregularities, some of which are cancer.
That you have to address, you know, at that point, which is probably difficult. They're coming in there for something exciting, and now you're having to address it.
It's very traumatizing, actually.
It is. It is.
So I know that you, Missy, are really big on their social media and helping in a lot of ways. So I just wanted you to kind of talk a little bit about the practice and your experience in there and what you do for them.
Yeah, so I basically just handle all of their social media platforms. I handle Dr. Rose's platform at Franklin Rose MD. I also handle the Med Spa, which is at Utopia Med Spa. So you'll see a lot of before and after photos on there, and for Dr. Rose you'll see a lot of surgeries that he's performed. This month we are actually hosting an event October 22nd from 2 to 5 p.m. We're going to have some light bites, some champagne, some sweet treats.
Exciting.
Yeah, some goodie bags for everybody coming.
And we will show how to do breast exams, and we will help you.
I
We're
think
there
that
to
would be very
support.
important to actually, you know, 'cause it's like,
Absolutely.
especially even when people do have implants too. It's kind of like, where am I? You know, is this my implant or is this something going on?
Right.
With the implanted patients, it's easier to self-examine those patients. Sometimes if there's a very large pendulous breast and the cancer doesn't get lost in the tissue, but it's just kind of harder. But if there's an implant, maybe the patient started at a B cup, now there's a C cup, you can examine that breast a little bit more easily.
Yeah, that makes a lot of sense. So Claudia, going back to, you know, this event, so you actually got to attend this event, all dolled up and all the things, and this was before you actually were able to go in and have surgery with their assistants.
Exactly. They opened my eyes. He is absolutely an angel to this earth, and he's so humble, and he just hates all of the limelight and everything. But I'm telling you, this man is brought from God.
No, I hear wonderful things about him from everybody. So he definitely has an amazing reputation for all the work that you do. You know, plastic surgery wise and just in the community itself.
It's just not a surface level.
Yeah.
They get to your root.
Yes. That is so beautiful. So your foundation will actually take care of the cost of someone to have their surgery with you. Is that
correct?
Is
yes.
that right?
We take care of the surgery fees. I mean, now, again, we're doing the reconstruction aspect of it, post-mastectomy. If the patient has breast cancer, then we have to refer those to an oncology cancer team.
To be
we do the reconstructive part of it.
Okay.
Right.
So with a reconstructive, like after mastectomy, are you having to create like a nipple for them, or like what is that?
It just depends. I mean, it just so depends. I mean, things like nipple sparing mastectomies are now more in vogue. I mean, in the old days, there used to be something called a Halsted, after Dr. Halsted, radical mastectomy that just took the muscle, took everything down to the rib. Really, now it's sort of less aggressive in terms of the mastectomy portion of it. So it makes the reconstructive more easily performed. If the tissue's radiated, then sometimes we have to refer those, there's certain microsurgical flaps that we have to refer to various colleagues of ours.
Okay.
Oh, and definitely, there's so many resources. Again, there's tattoo artists that, I mean, if you can't, they make beautiful artwork, and you have your balance
to do the nipple. Okay. Yeah. Okay. Yeah. No. And another thing too, you didn't go through any chemo. You just did radiation. Is that how common is that to not have to do chemo?
It just so depends. It's sort of like who is the oncologist. Some would prefer radiation therapy. Some might prefer chemotherapy. If it's an estrogen sensitive cancer, then there's certain other modalities that can be done. So the oncologic or cancer aspects of it are really their own little, their own little thing.
But that was probably, I mean, you know, because the radiation doesn't take away your hair, right? Is that the chemo is usually what does?
But radiation has its own pitfalls.
Can do it too.
It can cause tissue induration, tissue damage. I mean, the best outcome is if a patient has a really early grade called carcinoma in situ, or maybe barely level 1, and just do kind of a localized excision.
Okay.
Needs no chemotherapy or needs no radiation therapy.
Okay.
And you can go direct to implant reconstruction in those cases.
Oh, great.
But of course, then there's advanced cancers too.
Right. And you've been cancer-free now since 2017?
Yes,
Okay.
I have. And
Beautiful.
every year I go, and every month I do my exams, and I'm
Continue to-
clean and bill, everything is fine. I chose to live a different life, less pharma, more, healthier life.
Holistic and just kind of looking for all the organic.
A cleaner life,
Yeah.
less sugar, less red meat, just a clean life. Dr. Rose is huge into yoga, got us all into
That's great.
mental health clarity and physical health clarity. He really pushes us to really sweat out the cancer and work it out and walk it, run, and it's just really mentally.
It's hard to say why
strong.
breast cancer is so much on the uptick. You wish it weren't the case. It wasn't the case, but who knows?
Yeah, who knows? So with Utopia Plastic Surgery and Spa, what all do you do in addition to breast augmentation? Because I know, pretty sure you do a little bit of everything.
Tomorrow it's face, neck, and eyes.
Okay.
Abdominoplasty, liposuction, lots of rhinoplasties, just the full scope, really, of cosmetic plastic surgery.
Okay, that's fantastic. So you get all these before and after pictures
Absolutely.
and make them seen for everyone to...
Yeah, I actually sometimes will go into the operating room as well and
Marina's
get some content.
Been in the OR.
Yeah.
I joke around with her. She should have gone to medical school. She's very
She's so educated.
confident in the operating room. She's
Great,
very feels quite at home.
That's perfect. It's great to have that combination from her.
So I get a little bit of both. I get to enjoy the surgeries and get to enjoy the Botox and the fun stuff as well.
Right.
Yeah.
I think it's beautiful that you incorporated the med spa aspect too. I know that that's kind of common, but you're probably one of the first ones that were like, let's offer this in addition to this.
We were one of the first plastic surgery and med spas. We're in Uptown Park. Now there might be 25 within a mile or two radius of us. But I think it's very helpful to have a plastic surgeon at the helm of all of these procedures, really.
Yeah, no, I think that's huge.
You're in a medical place, so
right. Yeah, you feel a lot more.
A Botox place down the street, and this is a medical facility, which very licensed people. It is very comfortable, and they're there to give you your best. What you want.
Right, 100%. Well, Dr. Rose, is there anything else you want to share with the audience, like in regards to awareness, your practice, just kind of to leave them with?
Just be very vigilant in terms of breast self-examination, and if you're not sure how, there's many resources how to examine those breasts, or the patient's primary care doctor or a gynecologist can help in that regard. And of course, we're always happy to see patients as well.
Wonderful. And where can they find you guys?
At Utopia Med Spa and at Franklin Rose MD on Instagram and Facebook.
And we're in the Uptown Park neighborhood.
Great location.
Just north of the Galleria.
Wonderful. Yeah. Well, thank you all for being here. Thank you, Claudia.
Thank you for having us.
Thank you
Yes,
so much.
I will see you guys around town.
Yes.
And have a great day. And thank you all for tuning in to another episode of Hatching for Health. We'll see you right back here next Saturday, and we're going to be talking about fertility, so you will not want to miss it.